recognize John Boccieri of Canton, Ohio. 2 minutes.
Gentleman is recognized for 2 minutes.
Thank you, Mr. Speaker. Thank you, Mr. Chairman. The American people have asked for common sense in their government, but all too often it's just not that common. You see, our friends on the other side have asked for simplicity and substance and competition in the health care debate, but only in Washington will we argue that competition doesn't reduce costs. Only in Washington would we argue that we haven't had time to read a 2-page bill. Only in Washington would we argue process over results for consumers. What does it mean for consumers in Ohio? Well, let me tell you that small businesses in Ohio, their premiums have rose about 129%. 7 point Ohio get their insurance on the job, averaging about $13,000. Small businesses make up 72% of all business in Ohio, while only 47% of them can afford to offer health insurance for their people. We have seen 400 mergers in the healthcare industry over the last 14 years, so 95%, according to the Department of Justice, health insurance markets are highly concentrated, means there is collusion. It's simple economics. We increase competition, we lower prices. On this matter, we have to know who we will stand with on this hour. Are we going to stand for families, or are we going to stand for monopolies? Are we going to stand for competition, or are we going to stand for price fixing and collusion? Are we going to be congressmen and women who stand for consumers and open markets, or are we going to be